Another course on workforce planning. That's the topic. The course is course E. This is WRaPT Frontline, which covers those skills you might need in frontline workforce planning. And this is session 2 of that, which is the project. So this course is a bit of a weird one, but it is my suggestions around a project that might allow you to get the chance to develop skills in workforce planning across an organisation or across your division or across your team or across a system, and it will cover those individual aspects as we go through. My name is Colin Nuri. I run Carados Limited. What we do is focus on building skills in frontline health and care managers. Essentially, workforce planning is at the heart of almost everything we do. As you will see as we go through this project, cost control can be looked at very much from a workforce planning point of view as well, for example, as can customer service in some cases. We work with Lancashire and South Cumbria NHS Foundation Trust and Health Education England, HEE, to provide and support the WRaPT tool. And the WRaPT team are a great bunch of people based in Lancashire who provide a free-to-use online secure workforce modelling tool which you can use to record your current state and your future state scenarios and do some scenario state planning. It is absolutely cracking system, and it is free to use. And the free to use tool and this free to use training and the almost free bumper book of workforce planning is part of just providing tools and techniques for people. In some respect, we don't really mind what tools and techniques people use, never have done. The key thing is to do something with them, which you can only do if you have the capacity to do it, the time to do it, and you're only going to get that time to do it if you have got support from your organisation, and that's going to become absolutely critical. We're going to go through this pyramid again in this course, just to overuse this slide even more. Whatever happens, you want to make sure you've got a project underway to help you not only get the buy-in from your organisation, it's a reason to learn, it's a chance to practice, and it's something that you can use to prove your success. We talk about that every time, but it is critical that you don't just read through or listen to these sessions. You need to actually use them for something. This module. So we have been through all sorts. We've looked at what workforce planning is and isn't. We've looked at how to redesign it in that big course, WRaPT Redesign. We've looked at how to model specifically using the WRaPT tool itself. We've looked at how to develop a workforce plan, which we call WRaPT Plan, and the features of a workforce hub, which we call WRaPT Hub, because we put the word WRaPT at the front of everything. This is a frontline workforce planning course, which we call WRaPT Frontline, and it's the second part of it. It's a project to develop those skills that we talked about last time. I am actually recording this back to front, so it's slightly in the future, but I'm pretty sure we would have covered those skills in a previous session. What we're going to talk about is we're going to go back to the pyramid, why it's important. We're going to talk about the executive agenda, and then we're going to use the sort of WRaPT redesign approach to think about a project that we might undertake to help us improve frontline workforce planning skills for the good of the organisation. I think we'll go through this again in more detail in a bit, but the WRaPT process is going to be vitally important as we go through this process. I'm going to talk about things to think about in each of these different stages, scoping and mobilising the project to make it work, the approaches you take to understanding the current state, developing the future state, modelling the future state, and implementing as we go through. And if I haven't copied this slide again later on in the presentation, I will come back to this one because it is important. So, WRaPT Frontline, the project. Let's think about this then. Let's think about why am I talking about this stuff? Okay, let's just take a break at this point. If you're developing frontline skills like we talked about last time, you are going to need to make sure that it's relevant to your organisation. Because I've said in the pyramid, you're not going to get the time to develop your skills and to develop the skills of your teams and develop the skills of every frontline person if you don't have something solid you're going to get at the end of this. All right. Now that thing might be workforce planning, whatever. All right. It might be just having done workforce planning, and we'll talk about some of the reasons why, or some of the other reasons the executive might be interested in this. But what I'm saying is, if you want to train a whole trust or a whole system or a whole practice in workforce planning, team by team, developing their skills, you are going to need to make sure you deliver some outcomes that are relevant to your organisation, and that's going to help you engage your system, right, or your organisation. We'll provide the tools here. You're going to provide the capacity, but you need to get that engagement, and you're going to do that through a project that meets the needs of your executive team, and that's what this is about. If you're not going to bother doing this, that's fine, but I'm not sure how you're going to get those skills trained up in people without meeting an agenda. One of the skills we talked about last time was rostering. You can look at nurse rostering. The only reason you get a chance to train people in nurse rostering, most of the time, certainly do a large-scale training program, is because you're doing a nurse rostering project, and that people are expecting to get some benefits from that nurse rostering project, which means they've paid for people to come in and train people on nurse rostering. And hopefully there's a whole project checking, monitoring, and making sure it's having the impact it should have. Not that that generally happens, it's normally a mess, but there you go. So the pyramid is very important, especially for this one, and that's what I'm talking about in terms of this here. Now, the reason why I talk about this project is that I've done these projects a lot in my time, and I did them for two main reasons. The first main reason I did them for was to reduce or control cost. About 10 years ago, at time of talking, the NHS went through turnaround. And when it went through turnaround, executive teams were very interested in how they were going to balance their finances. Now, I think that's going to raise its ugly head again pretty soon. In private organisations, it's already important, but in public organisations, it will become important again when the magic money tree finally stops burning. But it is going to be important, and workforce planning can be used as a mechanism to reduce or control cost. Secondly, workforce planning in its own right has been a reason for doing it. So sometimes the central desire is to have teams that are workforce planning, that we've produced a workforce plan for our organisation which has a current and a future state, that has thought about the future, that is innovative, that is redesigned, and because somebody in the trust, an HR director normally, but often a CEO gets involved in this as well, and sometimes a finance director, has been told that they need to make sure they've got a workforce plan, or somebody has decided that they think we need a workforce plan. So actually, workforce planning for its own sake is important. Could be a reason, and that's two reasons I've done this for. I've sort of done this for the third thing in what we used to call an operational grip program, and I did it once for a large-scale private organisation. You might want to go through this to build operational controls in an organisation. All right, you might want to get to actually build some sort of control. When people come into the NHS, as I did from out the private sector, you can often be somewhere between worried and completely horrified with the lack of operational control that can be in place over people operating on the front line, depending on the organisation, and sometimes on the ward or department. In the old days, and I'm showing my age now, Monitor, which was NHSI in a previous form, had a thing called service line management. And we used service line management. The implementation of service line management was one of the reasons for driving workforce planning. It was a program that you could use. Finally, you might, and I've never been asked to do this, but you might be asked to do this from a customer service and quality point of view. Wouldn't that be nice? You need to have a reason for doing this. So the executive must need to reduce or control costs. They must need to have a plan. They must need to improve control. They must need to improve customer service, because there is going to be weekly executive effort on this program. Yeah, it's all in capitals there. Weekly executive effort, because you're going to have that. There's going to be a regular meeting on this stuff, and you're going to need to make sure that people are progressing. They're going to have to lead work streams potentially. Their divisions or departments are going to have to do some stuff. So there's going to be executive effort. They're going to need to release staff time for training. That's going to have an impact. They're going to have to release central time for tracking, training, improving and troubleshooting, and paying for your time to do this work. So that is going to be a cost, and there's going to be a cost in frontline staff time as well. Okay, some of this cost might all be hidden if it's done all internally, but there will be backfill and issues like that when you're trying to train people. There will be impacts on time. People will be complaining about this stuff because they're having to be taken off the front line or whatever else, and so the organisation is going to have some hassle. All right. So you need to be meeting the executive agenda here. Okay, absolutely vital. And it's that bit of the pyramid that we talk about a lot. Cool. I did put these bubbles in twice because I like this slide, messy though it is. We've tried several versions of this one. This is the best we have, which is scary, isn't it? There are 5 different steps to the WRaPT process, and we're going to cover each of these. We're going to look at each one of these in terms of what's relevant. But overall, there is a WRaPT redesign course which helps you to think about these things. It takes you through how do you develop a challenge, what would a project charter look like. It talks about how do you engage stakeholders. It talks about ensuring information governance, all this stuff you may need to do. We certainly will need to do most of it. It talks about the approaches you can use to understanding the current state and how you might collect data and show that data, and that's going to be relevant here. It talks about the development future state. It talks about workshops and the like. It talks about facilitation. It talks about how you engage staff with that information and how you align that to the challenge. That's going to be important here. It talks about how you model the future state. That's going to be important here in terms of how you model impact. And it talks about implementation, which of course is important. And no matter what you're doing, what's the point of doing it if you ain't going to implement it? So the WRaPT process, the WRaPT redesign process, is well worth going back to because it's a good, it's underpinned by just good improvement theory, I think. Here we go. This is the approach. All right. Now, I wonder when to put it here. I think I put it at the end as well. But there is an approach that you can take to doing this, which involves about 13 steps, which we'll take through. It goes through from mobilizing, having a look at where the issues are, because that's important, because once we've mobilized, we do need to work out where the biggest problems are from a data analysis point of view, as in where have we got problems? Is that high banking agency? Is that high vacancies? Is that high cost? Is that high variation of budgets? We need to work out the skills analysis to work out where the teams need the most help. So we need to have a look at where people need help. We need to establish our assets, who's going to help us. We need to look at what the qualitative issues are as well. We need to talk to people and say what needs to change to improve workforce planning in this organisation. And with all of that information, we need to design our future state. Okay, we then need to monitor our success against the delivery of that future state. And we need to develop reporting into the executive, get on with implementation. We need to support the change. We can constantly adjust the change. At some point, and probably not at that point, probably a little bit earlier, some of these areas could go in multiple directions. We need to build our links into our central functions. The basic aim is to make sure that this is business as usual, which is one of Kotter's key steps, and then we need to evaluate it and make sure it's had an impact, and I'm sure those arrows could go in multiple directions. But this is just to show you that there is a process we can follow, which we will recap at the end. But let's go into each in detail. So, from a mobilisation, block in the top right-hand corner tells us this is one of the blocks we're looking at. All right, so mobilisation, the first one. 4 steps in mobilise in the standard WRaPT approach, although these 4 don't quite line up to it. Well, let's say that they do, so it looks great. The first thing we need to do is develop the challenge. We need to understand what is the executive challenge. We've looked at that. We need to understand, is it impactful enough? If it's not impactful enough, then the cost of doing it will soon drive this off the agenda for people. So is it important enough? If the execs are saying this is fundamental to the survival of our organisation, we must develop a mechanism for delivering great care with a happy staff to meet our budgets, or we're not going to be in business, then yes, it's impactful enough. If they're saying it's important to us because staff are important to us, kind of thing, but there's no definition to it, is it going to be impactful enough? So we need to understand, is this impactful enough? Challenge the executive around what do they really want to exceed. We need to engage the stakeholders. Okay, so we need to think about 3 different groups. We need to think about the executive group, and we need to say, right, okay guys, you are going to be responsible for someone accountable for driving this through. You are the ones that we're going to report to each week on progress. You're going to make some decisions. You're the ones that are going to monitor this stuff across the organisation. You're in the box seat for this one. We also need to talk about the people being trained. Okay, so there will be a whole group of people that we are going to train in workforce planning to help address these issues, or all aspects of workforce planning. Those people are a group in their own, but they're not the only group involved. They will also have managers themselves, and they will have staff that work for them, and those are important as well to engage. But we do need to engage all of these individuals up front so they know what we're doing and what we're planning to do. Okay, the people being trained need to at least understand why it's the case and be preferably willing to do it. Otherwise, you're going to struggle to get improvements. The group. One thing worth thinking about then is think about the triumvirate. So we need to think about the fact of one of the reasons why things might not be working entirely is because we don't have a group that wants to work together particularly well. So quite often you end up with a team, a division, a directorate has got, and this is health, so it might not apply so much to social care, but you quite often find you've got a nurse, a doctor, well, a medic, a nurse, and a manager. And we need to think about who are we training here, and which ones should we be training, and who is in charge in each case. Because it might be we need to train all three, but it might be we just train the manager in that, and they provide these skills to the others. Triumvirate can be great and can be tricky. We also need to define the team, so that we can define team leader, and therefore the one that we are going to train. Typically, a team will be 20 people or fewer. Okay, so it's more or less a 20 people rule. Okay, the 20 people rule is based on the fact that that is a manageable group. If you're looking at a team where the team leader is running a group of 5 people, then you've probably gone a bit too granular, but you might not have done. You might want to go to that level. If you're looking at a team of 1,000, you're probably too high level. Now, they could be, if there was, for example, a team of, say, 100 people that were all doing exactly the same job, then theoretically there might be a single manager over those 100, but I really doubt it. All right, I think team of 20 people, round about 20 people, is a good one to use. It's one I used when I was doing some of this stuff at PwC. We use this quite a lot. So when you're mobilising, you need to think about setting up this project in those ways. So we've mobilised, so what comes next? Well, it's the current state is the next one. And we need to understand what's currently happening at the moment. So few things to think about. First of all, where is the problem in the organisation? Okay, which is what we'll cover here. So first thing is think about variances. So if you can analyse your organisation and see where is their spend versus budget, and where is that different, where is their variance in activity versus planned activity, and where is their variance specifically in spend versus the staff budget, because obviously budgets make up things other than spend. Those are the first 3 things to look at. Get those in a table, work out which directorates, which teams, which divisions are suffering from being adrift from their budget, either through activity or cost. You can then look at a whole host of other things in terms of turnover, employee feedback, staff review rates, as in when was the last time we had some sort of staff review, participation from those teams in L&D, training backlogs for those people, often linked to the other one, bank and agency use in those teams, team diversity in those teams, activity per person, sickness, absence and vacancies. If you pull all that lot together, you're going to get a very rich view, and you should be able to, by some careful mapping, work out, and maybe even prioritising or whatever else, work out where you've got a problem. It helps you to understand the total problem for the organisation as a whole, but you should then also be able to understand the problem by division, by directorate, by sub-directorate, and then ideally by team. That's for an acute trust, which is where I've done this a lot, but you can use a similar situation for anyone. You could also have this at system level, system, org, division, directorate, sub-directorate, team. But it helps you to work out where your problems are, and that allows you to target things, hopefully. Because if you've got a big problem in surgery, and specifically in orthopedics, then that might be where you want to start, because if you can start in there, maybe, you might want to start in some easy areas as well, but if you can start in there, then you can have an impact quickly and start proving your impact. We also said next step would be you need to understand what skills need developing. Okay, this is where you can do a skills analysis to work out where the problems are. Now, you can do 2 things here. You can use the organisations tool for this, if there is an organisations tool for skills. I'd rather use my own model, so develop a standard model for it, but you can if you want to use your organisations tools. What I tend to do is aim to collect a baseline of skills, because that's what we're here to do, is to understand it. Now, what you can do is you can assess people's skills. So you can go and assess people's skills, but if doing that is stupid, because it is time consuming, it is massively difficult, and it can be counterproductive. Because if you start saying, oh, I've checked Mohammed and I think his skills are here, and he thinks his skills are higher than that, then you're into all sorts of discussions as to why that is. And in the end of the day, this stuff is subjective in a lot of cases, unless you're going to be really, 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 really specific about individual elements and everything else. All you've done is wind Mohammed up with that, and it's not a good idea. So what you need to do is to think about self-assessment, I would say. Even when you think about self-assessment, you need to think about how you're going to do that self-assessment. There's all sorts of different ways you can do it. The way I typically tend to do it is through an interactive workshop. So what I don't do is send a spreadsheet out to people or a survey, because if you do that, people get bored of filling it in, and it doesn't tend to work, and you just end up with yes, no, yes, no's later on, because people are just bored, they don't understand it and everything else. Get people in a room with a small set of skills that are important, all right, based around the skills in WRaPT Frontline. Yeah. So is it budgets? Is it capacity? Is it handling diversity? Is it leadership? Is it rostering? What are those key skills that we have? You have to define those skills a little bit beyond just that one word, okay? But you just need to say, these are the set of skills, all right? So a small set of skills could be, say, 10 to 20 skills. Don't go up to 100 skills, all right? 10 to 20 skills, more than enough, all right? Ask people where they think they are and where they want to get to. All right, so that's what I've done here with the green and yellow dots, because you can clearly see then that budgets is a problem for this person. It's new to them. They want to get good at it. Green is where they are. Orange is where they want to get to. They want to get good at it. Diversity, they feel they're already good at it in this case. All right, and yeah, Mohammed is a good one on diversity by the looks of it. Leadership, a bit of training required. Rostering, yeah. They want to be okay at it. They don't want to be particularly good at it. Ask them how good they want to be at it. Most people will say they want to be at 4 or 5. Great, okay, but it helps to show that's where they want to get to and where they are. So you can just give people dots and get them to stick them on a bit of paper. Get people in a room, have conversations with them, explain what you're doing, get people to stick dots on a bit of paper or on their own bits of paper. Collect it in a more interesting way. If you get everybody to stick it on the same bit of paper, you can get a bit of groupthink. But if you do that, which is not always ideal, and you've got to make sure you mark the dots to make sure you know whose is whose, which makes it even more complicated. But if you do that, you've got lots and lots of dots on one page, you can very quickly see where perhaps we need to train people. That type of approach is one I use all the time, having this sort of different scoring mechanism. From 1, it's new to me, 5, can you teach it? It's a nice little way of engaging people in stuff quickly, rather than going around and asking everybody individually, which gets a bit dull and time consuming. What you then do as a result of this, you should have a skills matrix which tells you where everybody is at the minute, where we want to get them to, and then we can find, is there a set of skills that lots of people need training in which case we might need to do some sort of mass training, or are there some teams and individuals that need a lot of training, which might mean that we need to put specific coaches in there. Yeah, we might also find, are there particular teams that have got major problems that need some very specific training, some specific coaching. We also might find some teams which can help out because they're really, really good at this. If they're really good at it, can we engage them? That would be a great way to do it. Which takes me on to what assets exist to help, because there should be other things that we've got. My phrase that I've used in a number of these courses and explained far too often is the phrase, we need more teeth. And workforce planning is such a big job at the minute. We need to get as many people helping us as possible. Okay, and in order to do that, we need to understand what assets exist to help. From the previous one, we found those helper teams that we might be able to get to help us. But what else might we need? Well, we are going to need project management for this project. We're going to need to do quite a lot of education and training. We are going to need to coach individuals to help them improve. And we are going to need central teams to help us with stuff. Okay? So from a project management point of view, we're going to need project management. We're going to need a project management office. And we're going to need to do some executive reporting. Are there improvement teams around? Are there project management teams around? Are there project managers around? Is there a PMO already? that could help us to do this stuff? Could they do the elements of that? From an education point of view, we're going to need to develop some courses. We're going to do some digital training. We're going to have to deliver some training. We're going to have to deliver some materials for people. We're going to have to develop a redesign approach, unless you use this one, which I would thoroughly recommend. You can use WRaPT redesign, and off you go. But you're going to need to do those things. So is there an education and training team that we could engage on this? Are there transformation and improvement teams that we could engage to help us with the coaching? Because when we are delivering this one-to-one with people, we're not just going to do training. We're going to coach people, help them to do this stuff. Do those teams already exist? The central teams can be really helpful in a whole host of different ways. The HR teams will be able to help us with improve the recruitment, retention, or whatever else we need to do. The improvements against the number of people that we do reviews with, etc. Finance going to need to help us with the financial numbers and how we're doing. We might also need to get budgets changed, so we need to get finance involved. Estates might need to make some changes to help us when we're doing some redesigns. Same with IT. We might need some new tech or improved systems to be able to reduce our workforce requirements. So we need to engage, work out who exists, what assets exist to help us out there, and get them engaged in it. So the last bit of collecting data is this qualitative issues bit. And this is where it fits into the sort of cost reduction approaches that we've used before, and fits into the cost reduction training that we do as an organisation. But if you are going to be doing you're going to be collecting quantitative information, it's also a really good idea to collect qualitative information, which is to get people to tell us where their issues are. So one thing you can do is just go out and talk to people and say, what issues do you think there are at the minute that stop us workforce planning? What workforce issues do you have? If it's about cost, what are the cost issues that we face from a workforce point of view? If it's customer service, what are the customer service issues we face? If it's about operational control, what are the control weaknesses? You just go around and ask people and say, what do you think? You just create a very big Excel document with loads and loads of ideas in it. Then you can theme them, and then you can say these are the things we need to work on. It's quite handy, yeah. Or what you can do is you can go out with a list of issues, and you can say, do they apply to you? So in our organisation, we've got a whole load of posters of different ideas that we ask people to rate on there in terms of where they think they are and where they want to get to on those issues, a bit like we've just done before with the skills matrix. You can go out with a list of those issues. Or you can do a bit of both when you go out and ask people for issues. First of all, build a bit of a list and then check with everybody where those issues fall, so that again we can combine those with the other issues to say, surgery looks like it's got quantitative issues, and it also looks like it's got qualitative issues, so therefore we better target that area. Or other than quantitative issues, but actually it's really good qualitatively, everyone thinks it's brilliant and brilliantly run. What does that mean? Does that mean their numbers? Does that mean that their targets are wrong? If they're really, really well managed, it's more grist to the mill in terms of working out where the issues are. Great thing is as well, you're going out talking to people, which is great, and you can also focus on strengths as well as issues. So don't just collect issues, collect opportunities, but also collect strengths. What do you do well? Because there's nothing better than repeating that back to people, so it doesn't seem too negative when you're reporting back. But also, it's the stuff you want to keep and learn from, as well as the stuff you want to lose in terms of the issues. So by that point, you should have a complete set of current state, which should be, as the WRaPT design approach tells us, you should be able to pull into something that tells us where's the opportunity based on the data, what skills need to be developed, and then if you compare what skills need to be developed based on the opportunity, what does that tell us together? It should tell us we ought to focus here first, we ought to focus on these skills for everybody, we ought to focus on coaching in these areas, we need to give these teams some specific training in these areas. So we design the future state, which we should design in workshops. It's always good to engage people with those, but it's certainly worth thinking about what's the opportunity, what skills need developing, and what do they tell us together, and then linking that through into a high-level plan. Okay, and that high-level plan should involve it should have involved stakeholders in that journey, putting that plan together. We should have involved any steering group that we've set up. we should talk about we should be talking to people in the organisation, those potential helpers that can help out, and we ought to be looking at the development group that we're going to be developing. We ought to be getting their views on this as well. So a workshop's a great way of doing this with that information, engaging those people to develop a high-level plan. How do we move from where we are to where we want to get to? And the plan will typically consist of a few things. Okay, it will consist of the project as a whole that we're going to be working through. So that plan for that project as a whole. We're going to start here and we're going to finish at this point. It's going to talk about the training program. So we're going to think about what are we going to train in. It's going to think about the coaching program. So how are we going to help each individual area develop using that training that we're providing, because that training will be there for people to call on, but the coaches will have to help people to identify what training they need to be on, train, and then get the output from it. We'll need to think about some redesign projects that are going to come off the back of this, because each team will probably go through a redesign for their team, and that might be in larger groups where they might look at a whole pathway rather than looking at a team by team basis. And then there'll be some infrastructure projects. Okay, so there'll be some projects around like we need to change a recruitment form to include this, which will attract more young candidates or whatever, or we need a new scheduling system or whatever else. Those are infrastructure projects that we will need. Talk about those in a bit of detail. So that is designing the future state, and then you've got to implement, and that implement will cover all sorts of different elements we've already talked about. So we'll talk about monitoring success. How do we monitor that success? How do we report that into the executive so that they can check this each week to make sure that things are changing as a result? Okay, so we need to develop that stuff, and then we need to implement and run that. Okay, as I say, those implementation of this is going to be in all of those different areas we talked about. So there will be governance for this across an extended time frame. Could be 6 months, could be a year, a couple of years, or whatever. And eventually this will need to become business as usual, which is where we're talking to building linked into central functions. There's going to be education, so those training courses, we're going to have to develop those courses. Either we develop them internally, or we find some external options to develop them. And and the education program will involve everything else, like booking rooms, monitoring who's been on them, providing materials and certificates and everything else. It might mean putting in place digital learning, so digital versions, online skill matrices, or whatever else. So education-wise, we're going to have to make sure that people can be trained in this stuff. Obviously, you may already have a service manager training program, but which might already include these things. That would be great. But if you did have, and it was going well, why do you need to do this? So there's bound to be certain things. The coaching stuff is that we really need to make sure that you have got people working with each area and with groups of areas to help them move them along, to learn what they're doing with the training and to apply it to what they're doing in their team. It will not be a one-to-one, and the coaching will be, you'll have all sorts of different levels of coaching, and you may or may need to introduce bigger and bigger hitters to help these areas solve them. I have worked with areas that will resolutely refuse to learn skills in these circumstances, so it is worth making sure you've got a whole range of different people who can coach. And as I said before, you've got obviously those people are going to be used the coaching approach that we've already talked about. Then you've got the redesign projects and the infrastructure projects I've already talked about. So you need to make sure those are all in place. You're going to need to support that change, the change management throughout it, and deal with issues that come up. You're going to need to constantly adjust where we are. As I say, then eventually build this to become business as usual by building these links into central functions, and then continue to evaluate to make sure that things are not slipping. Hopefully are continuing to improve. So that is the project as a whole. It's one of the ones that does get used with in turnaround if you're doing it properly. A more engaged approach to turnaround is to improve people, help people to improve. Sorry, not improve people. Help people to improve. Help people to develop within their areas. And provide a mechanism for them to do their own jobs properly, rather than consultants come in and tell them how to do their jobs and then wander off. It differs from the sort of more standard approaches to this stuff, where you're not developing people's skills. This is about developing skills, and while developing those skills, solving a problem. But at the same time, you can build an executive level plan as to how things are going to change, how things are going to improve, either on workforce planning, customer service, cost, um, or control basis. Bit of a weird section, that. Not sure if that'll land with people. I think there's a lot of good learning in there, but people might just shake their heads and think, why am I doing this? But that is one thing for you to think about, I think, when you're looking at frontline courses, frontline skills. So, what are the next steps from here? Well, you can, if you wish, register to the WRaPT tool. You can buy the bumper book of Health and Care Workforce Planning, available on Amazon. You can visit the WRaPT website, the Health Education England Workforce Planning pages, or the Carados website. Please get in touch with me through the Carados website if you want to. You can have a look at the YouTube. You'll be looking at more YouTube courses, such as the WRaPT Plan, the WRaPT Redesign. That should say start the WRaPT Hub course, because we're in the WRaPT Frontline course. But if you started at the end, maybe you want to start the WRaPT Frontline course, who knows. If you've enjoyed this, if you found it in any way useful, subscribing really helps. Dinging the bell, liking it, commenting, preferably nicely, and I think that's about everything you possibly can do. Skywrite about it, whatever you want, that would be great. But yeah, please check out the other courses. Cheers.